Well, thank you so much, all my friends. I know you would like to spend your time to be with us. It's my honor. So today, my way to create some issue is we have to clarify and think critically. That will help our practitioners can do well. So the reason why I raise this issue is because in the industry, they try to educate us, or most of the practitioners, they try to inject more for our patients. So that's the reason why that the overfilled situation is very common. So my opening will be about why we should think differently in creating Asian beauty. So I have no conflict of interest, and we'll age, but age differently in different groups. And I believe many audience here will prefer the facial shape of Caucasian, which is narrower and slimmer. But Asian have a wider and rounder face. So when we're doing procedure to correct facial structure, the difference is that we should think about the difference between these two faces.
Okay, it's perfect.
Okay, so I'm going to make the case that we don't have to worry about facial shape ethnicity. So with facial shape, I think beautiful people, this came from a consensus document that some of the people on this call are on. Beautiful people of all races show similarity in facial characteristics while retaining distinct ethnic characteristics. This was quotes from this paper, consensus paper. And Asians are not a homogeneous group, but rather comprise many varied ethnic origins, with each group having its unique facial characteristics. Kind of true, but not true. So first of all, I think we have to consider that facial shape is important in a huge number of very practical ways we look at it ourselves. One is obviously on gender dimorphism. In other words, the prototypic male, the prototypic female are all different in facial shape. But there is a fluidity.
Kind of change. So as we mentioned, the aging process, when it starts, when the aging process kicks in, it makes things even worse, where you have structural changes in terms of bony decay, soft tissue atrophy, especially in the deep fat compartments. Now in Asians, we don't have much superficial fat pad atrophy, but we do have hypertrophy over the jaw, nasolabial flow, and also soft tissue migration and the skin envelope's elasticity. So what makes it more complicated is you start to lose the facial shape into more square. You start to lose the projection. And this is exceptionally important to Asians because we start with a poor projected face. And then you start to lose the good proportion.
Person, individuals to individuals, and also that there are some so-called ethnicity differences. And all this has to be taken into account. And when we look at why we want to put fillers, and I think I always say dermal fillers is a misnomer because we're not putting into the dermis, or we're not putting into the skin, but we are putting into the fats, and actually to support some of the skeletal structures that has been changing. And basically, I also agree with what Wilson brought up earlier, is that there will be some structural changes that causes our muscles to behave differently. And by sort of supplement the support to all these muscles, it will actually kind of restore back the muscle function as well. And what we've seen in the past is that we always place too much of fillers that cause the disharmonization of the whole face. And I totally agree, and we should work on
So do we have to make our patient, our customers feel like super satisfactory? I don't think so, because at least for my patient, at least for the patients who don't visit plastic surgeons and visit dermatologists, actually their anticipation may be high, but it is not very, super wanting type of patient. So I think just a moderate improvement and moderate, satisfaction is okay, or even better for certain type of patients. And if you are my type of, doctor who really every day deal with patients with very conservative mind. Is, oh, I don't want too much changes, just a little bit, okay, I'll be very satisfied. Then don't need to inject much, although super injection, super volume, heavy volume injection will cause much improvement and supreme patient satisfaction. So